Good morning, everyone. How many of you have encountered cancer patients in your practice and wished you had more tools to better support their health and well-being? Please type yes in the chat if you're ready to expand your ability to help patients with cancer feel stronger, more balanced, and resilient. Today, we are fortunate to have an expert who will guide us in learning how acupuncture and herbs can play a transformative role in supporting cancer care. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content, with over 200 speakers, 700 courses, and 3,000 hours of CE. We appreciate you all for joining us today. Allow me to introduce our speaker, Dr. Jonathan Law. Dr. Law comes from a distinguished lineage of traditional Chinese medicine practitioners and is a fifth-generation TCM expert. Born in Guangzhou, China, Dr. Law began his journey in TCM at a young age, mastering the art of herbal preparation and processing. He has received advanced training from South Baylo University, Guangzhou TCM University, and Beijing TCM University. Currently, Dr. Law is a respected educator at Southern California University of Health Sciences and operates his own clinic in Costa Mesa, California. His dedication to preserving and innovating TCM makes him one of the most trusted voices in the field. Today's class is Optimizing Cancer Support Using Acupuncture and Herbs, sponsored by Evergreen Herbs. Dr. Law will focus on how TCM can complement conventional cancer treatments to help patients manage side effects like pain, fatigue, and digestive issues while enhancing their natural defenses. By the end of this session, you will walk away with actionable insights and techniques to elevate your practice and make a lasting difference in the lives of your patients. If you're interested in learning more about oncology, be sure to check out Dr. John Chen's course, Herbal Safety in Breast Cancer, Dr. Shuhong Lo's course, Western Medical Practices in Clinical Oncology, and Dr. Peter Sheng's course, TCM and Western Approaches to Breast and Colon Cancer Care. In addition, Dr. Law will also be holding another live webinar next month about TCM treatments for women's menstrual and reproductive health. I'll put all the links in the chat room for you shortly. And for our new attendees joining us, allow me to familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by Monday late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and join me in welcoming Dr. Jonathan Law.
Thank you, Myra. Good morning, everyone. Can everybody hear me okay?
Yes, good morning, Dr. Law.
Yeah, I see some familiar names on the list. Now I'm in the full screen. I got a question on the full screen. Would I be able to see the chat box?
Yes.
How would I navigate that for just for make sure? Oh, does that matter? Let me see. Let me try to navigate.
Yeah, on
Exit
the
full
full
screen.
after you share the PowerPoint of the law, you
Okay.
should see a chat box top of the control panel. You should see like a little notification when comes up. Anything on the Q&A or the chat box, you should see a little red mark to be like popping. You could click on it, you can open it up, you can read them. You can try that if you like right now. Go ahead and share the PowerPoint first.
Okay, I can share the PowerPoint. Share the PowerPoint.
Okay, wait up, it's coming up now. Want to do from play the full screen first.
Okay.
We see the full screen now. Right here now, Myra, can you type in something in the chat room? Let's see. Okay, we're gonna type in something for you in the chat room.
Okay,
Okay, do you see it on the top
I
of
see
the
it
screen
now.
now, the
Good,
little
fantastic.
box that say chat? You
All
can
right,
open it up
I
if you
got
like.
it.
You got it? Yeah, you
Everything's
could,
just set
like
up.
open up or hide it, when you don't want to read it.
Okay,
Okay?
all right, thank you. Thank you, Sam.
Okay.
Good morning, everyone. Thank you very much for coming out or log on for to attend this class on a Saturday morning, pretty earlier, 8 o'clock or so. First part, before we get into our lecture, I want to have a disclaimer that I am not an oncologist per se, but I have opportunity to do extensive research and also have opportunity to work with a lot of the cancer patient co-managed with along with biomedicines to help strengthen their body, walk them through and assist them through the biomedicine interventions such as chemo, radiations, targeted immuno, etc. So today we have a full menu for our webinar today. So I'll be going over lung, colorectal, gastric, liver cancer, uterine cancer. I believe there's a 5 or 6, but depending on how much we'll be able to get through, we also have tentatively scheduled a part 2 for the continuation of today's lecture. My name is Dr. Jonathan Law. I am a 5th generation in TCM. My great-great-grandfather is a royal physician for the Qing dynasty. I have the opportunity to learn a lot from my family tree, as well as some of the experts in the field. My 2 iconic teachers are the iconic figure from Beijing University, Dr. Jiao Shu, he's the expert in herbs, and Dr. Cheng Nong, who's the author of your handbook that we all use for acupuncture. I've been practicing for about 35 years and also been teaching among multiple schools in Southern California, South Baylo University, Alhambra Medical University, and currently I am with Southern California University Health Sciences for the last 25 years. Today, we will be discussing, give you a overview understanding of the oncological disorders, how to manage if you encounter patient. I'm sure cancer become quite a concern for the last 2 decades. Numbers on the rise and both cases reported, as well as the mortality or the death rates. So let's talk about cancer, the formation of cancer, and why and how. So as we know, this is just a basic science. Our human body is composed of cells, many cells. Cells grow and die, and they go through a cycle. Cell, the basic building block to make up our tissue, organs, eventually form the body. These cells are genetically programmed to do numbers of things throughout our lifetime. Cell will come and go, grow, dies, and then get replaced. What causes cancer is certain cell, the function of DNA repair is probably the most significant part. We'll talk a little bit more about others later. The function of a DNA repair cells has become faulty, have no longer able to regulate and then enable a certain cell to grow uncontrollably, cell replicate, cell duplicate. Eventually, that will form a tumor, a swelling. Let's take a brief pause on this concept alone. How is that in TSAM interpreted? This, the formation of a mass in TSAM, I'm going to jump back and forth, try to integrate it so you can have a better view. When a tumor is formed, a mass is formed in TSAM, we'll consider that qi and blood stagnation with the possibility of formation of dam phlegm. Possible etiology of heat involved or cold involved. However, this swelling here, the mass here, it might or may not be malignant. It could be a very benign. What makes it benign? What makes it a malignant tumor mass? A benign is like a cyst, a mass that is well defined within a capsule and also do not see any probability of vessel infiltrate. The margin is well within the norm, but when it becomes malignant, is the margins somehow become fuzzy under radiology, but definitely there is vessel infiltration, surrounding tissue involved, and it's known as the lesions. And when it starts to have the capability of spread, or in this case, metastasis, that will definitely classify this as a cancer or malignant tumor. So the process of cancer development started with somehow, we talk about DNA repair gene and the P53. Along the way, those become impaired or fault mutation to take place. Cell formation started, tumor form, and eventually vessel infiltration or invasion or start spreading to other part of the body, and that is called metastasis. So understanding the cancer biology. Cancer is a group of disease. It could be affecting any part of the body, whether the lymph system, specific organs, on the skin, vascular, any part of the body is basically this uncontrollable cell growth. Cancer cell lose ability to regulate its own and divide indefinitely. We're going to talk about P53 and also the DNA repair later. Invasions or metastasis. This is to say that tissue could be spread, vessel infiltrate, get into the bloodstream, eventually affect the lymphatic system. Once that happens, that is when it starts to spread onto adjacent organs or other specific organs in our system. Genetic mutation. Cancer is a typical cause of mutation of gene that control the cell growth, division, and death. So The fourth bullet point of this is diversity. Because not all cancer are created the same, meaning they have that tendency, if it affect this particular organ, affect that particular organ or system, you're gonna have issue. So they are not. So with that, tumor cell, dysfunction of the cell related to uncontrollable growth divisions. So this is what we'll talk about. We check out the oncogene type. Oncogene and suppressant, tumor suppressant gene. Anybody familiar with the term oncogene by any chance? I guess it's okay. This gene normally promotes the cell growth and division, but when they become mutated, they can overact and drive uncontrollable cell growth. Now, why oncogene is important to know? I just want to jump ahead of this. Typically, oncogenes are used to assess breast tumor, breast cancer. And recently, they have been used oncogene DX, both of them, for colon cancer screening as well. The reason why we have this oncogene is highly recommended. When you test the oncogene, it will give you a marker score. The higher the number, meaning it's susceptible to metastasis. So in the early stage of detection, especially with breast cancer, if you do have the oncogene testing, it's a little bit pricey. Some insurance might or may not cover. A lot of doctors have discredited, but I think it's absolutely very relevant. Some of them are not very familiar or are not in tune with this. The reason why I said this is important is because it measured the gene, the makeup with the score. When the score is high, for example, then we know this patient could be a stage 2, stage 3 cancer, but yet this patient will likely respond positively with chemotherapy. But your oncogene DX test score come back if it's low. For the example, in the case of breast cancer, if your number come back, the number was actually between 0 to 100. If your number come back 10 or 12 or below, means you are not a candidate for chemotherapy. So a lot of people fail to have this assessed and follow with drastic chemo or targeted. The result is unfavorable. And we will talk about chemotherapy, that not just overall chemo, just go in there, address the need of cancer cell, but also wipe out a lot your healthy cells, including your organ function, etc. So that's why the oncogene is extremely important to test if you do have breast cancer. Okay. Also, make sure, God forbid, any one of you or any one family loved one do encounter early stage of that, make sure request your doctor to get an oncogene. Yes. ONCOGENE. Yes, oncogene. So make sure we request that. Get your doctor on board or oncologist on board with that. The reason why I share this information with you, I have two, my sister, they are breast cancer survivor. My older one had registered a different oncogene type. My younger one also came back with she was adamant about requesting the oncogene testing. When she had the issue, the doctor immediately ordered a mastectomy, but followed with radiations and chemotherapy, she refused because she said, until the oncogene is come back with the result, I am withdrawing or withholding my option choices. Finally, her oncologist came on board with her. Said, okay, we're gonna order this for you. Once the result come out, we'll talk about it. So her oncogene came back 2 consecutive. One came back at 8, one came back at 9. With that number, her oncologist finally agreed that chemo is not an option for you. The story is, if you don't have this and you add in giving chemo, not only it will create more damage receiving the chemo dosage. That's correct. Carol's shared good thought. That's what I'm trying to convey here. Because it's important. Now, oncogene DX is also being used for colon cancer. So the reason why I brought this up is because the diversity. There are many different types of cancer, and each of them have a very unique makeup. So we cannot see a human body as a typical prototype. You have to evaluate each and individual. Once I start integrated in the TSAM perspective, and you probably would know why. So let's talk about exposure to carcinogen. If you're interested by the American Cancer Society list a number of carcinogens, so I decided to share this link for you if you got interested in doing this. You can click on it and give your long list of a few hundred things and break it down certain type and to certain part of the body, a certain organ, etc. So because you are exposed to carcinogens, absolutely warranted the higher risk of developing disease. However, not all exposure to carcinogen would develop cancer. Understand why? This is a very interesting statement. We know that if you long-term continue exposure to cancer-causing agents, your risk of developing cancer is higher. That's given. But if you expose to this carcinogen, why some people would not develop cancer? So that we have to come back to our DNA repair mechanism. So what is DNA repair mechanism? In our system, we have cells that are intended to repair, to replicate cells that are having a tendency to mutate, having a tendency to form abnormally. This will help to repair. Once it's repaired, it will inhibit the abnormal growth or cell division or cell replications. So we have that blueprint in our system. That is by Western biomedicine perspective. Second thing is detoxification. How well you are able to eliminate the impurity. The thing that could potentially cause cell mutation. And what is your genetic factor? When we mention these three things here, I can't help myself pulling back and try to integrate that with TCM. So look at this. Genetic factors first. By biomedicine standpoint, that is your blueprint inherited from parents. And we have the same explanation. This is your kidney acid. That kidney function, both are acid, qi, yin, and yang aspect. Those are things that you inherit from your parents. And that is exactly the genetic factor. Detoxification system. What is detoxification system? The detoxification system, here you have to think from a TCM standpoint. These are your hollow organ system. Because hollow organ system enable you to empty and eliminate. So eliminate the detoxification system by biomedicine standpoint, we talk about your bladder, urinary tract, GI tract, skin ability to perspire, eliminate toxin, remove impurity. So you have to think about hollow organ in TCM. Hollow organ in TCM, such as your large intestine, your UB, your stomach, because all this have ability to accumulate. Once it accumulates, that is exactly why it enable or injure the DNA repair mechanism, allow mass to form, allow tumor to form. So when we talk about genetic factor, think about kidney. Prenatal and postnatal, which you think about your earth element, spleen stomach. When you talk about detoxification system, I want you to bring back your understanding of full organ. Empty, eliminate. So empty, eliminate is very important. It's kidney bladder relationship, lung, large intestine, small intestine that connects to heart, large intestine connect to lung. So I want you to try to integrate that concept. So when you're dealing with a specific type of cancer, think far and beyond. Not just, okay, we have a lung cancer, non-small cell or small cell, we need to focus on that. And that's the big difference between TCM and Western. Right here, I want to reiterate again. I know TCM had gone a long way addressing cancer is not a term that new, but we're going to talk about it a little bit later as the slide continues to advance further. Any question for now? It's interesting, Yasang. Oh, Yasang Yam. Oh my goodness, I haven't seen you, heard from you for a long time. She asked us, is a possible parasite can cause cancer? I don't think any authority will be able to give you that answer definitively, yes or no. Because anything could do or disrupt the normal cellular level, injure your DNA, or suppress your P53, that is potentially can grow cancer. Okay, so it's two major things. The DNA repair mechanism is injured, or whatever condition suppress the P53. P53 because they have numbers of different paths. Regulate cell, angiogenesis. Well, I'm a little bit advanced above myself. I'm too zealous on this. And one interesting things here, I want to make a note. Not all tobacco users would get cancer. The whole world knows. Tobacco, or specifically cigarette smoker or smoker, has the highest incidence. If let me rephrase myself. Lung cancer reported number with cigarette user has the highest ratio. And I also want to point out, tobacco itself doesn't cause cancer. Cigarettes with all the chemical and additive, those are cancer-causing agent, not the tobacco leaf itself. So ask that to why we have some, I forgot his name, George Byrne. We've been smoking tobacco, cigar, and he lived until over 100 years old and never developed lung cancer. And we have individual never smoked before, but do you get lung cancer? Have you ever wondered why? With that question being asked, then now let's swing back to TCM. Why? Because your immunity is strong. External pathogens that, or in this case, carcinogens, affect the body, yet your ability to fight it off. You have strong DNA repair genes that were able to maintain and balance and sustain, prevent it from develop into cell multiplication, which is eventually cancer. So I'll give you some basic cancer statistic. And this is, I don't know if they have a newer release yet, but it's about 20 million new cases worldwide, with about 10 million deaths. Project to increase by 77% in about quarter of a century. By 2025, US expect to see about 2.1 and about 620,000 deaths. Now this is including everything, okay? And this year, 22. So if you look at this number, 1.9 or 20 million, US alone make up for 10% of the cancer cases. And this is the death toll. Cancer cases rises and mortality decline. And that is because in our environment, we're exposed to everything. Microplastic, asbestos, barbecue, grilling food, processed food, cleaning agents around the house, vegetable meat full of hormones, etc. Mortality rates on the decline thanks to advanced screening, more developed technological advances in medical field, and more importantly, patient awareness. When you stop having things unusual, please do not procrastinate. Make sure you get it screened and checked out. And that will help to determine sustainable, curable in the early stage of 1 versus giving you a timeline in stage 4. And then cancer mortality rate have not been uniform across the global population, and that is exactly tied in with what? Environment, availability of healthcare, and whether patients are being educated with awareness. Environmental is extremely, extremely important. Like you work in a chemical field, right? Chemical environment. Okay. Let's put this very, very simple. Some of this, a lot of lady will understand with me. I seen a lot of the manicurists throughout the last 15 years. This particular professions, if they do develop cancer, is lung and liver, the highest incidence. Why? Back then, nail, powder, pack, that film, they are doing it 8-10 hours without the knowledge of needing to put acetone correct, without having the knowledge of need to get a fan, blow away the film as much as possible, and double mask it. They were not taught. Now it's much better since the pandemic. Everybody need to put a mask on. So I have educated them, said, when you start working in this field, I know that may not be choice, okay, your choice of career, but definitely bring some bread and bacon on the table for you. But you need to protect yourself and help yourself. So it's a lot of things that that's why it's not uniform across the global populations. Here's another thing that I'm giving you I think is quite interesting. We're going to talk about it later in gastric cancer. Anybody know in particular how many Chinese attendants we have here today? Maybe you can shed some light. In Chinese ethnicity, southeastern region, Guangdong regions, you know what particular ethnicity have the highest esophagus and gastric cancer? Anybody know? Okay, it's Chaozhou. Chaozhou, we have Chaozhou, Hakka, Cantonese, and all that. Fujian, right? Chaozhou people has the highest incidence of esophageal gastric cancer. Why? Absolutely. Darren, you hit it. Because in that particular culture, when they drink tea, they drink soup, they drink any liquid, I am talking about boiling point. If it's not super hot, they're not happy with that. Okay, so they are trained. So the hot liquid like that, when they drink it, is absolutely probably equal, if not hotter than your body temperature. Way hotter than your body temperature. So eventually it burns the esophagus lining, burn the stomach lining and create damage. Continue to do that, even you have a strong DNA repair gene, it's not going to be able to rectify that fast enough. That will create lesion, that will create suppression of P53. Eventually, that injury to epithelial lining eventually will mutate because cell will form to protect it, continue to multiply, and that eventually form cancer. This is alarming. 1 in every 3 women are men, so a third will develop cancer in their lifetime. Now, this is not just lung cancer, okay? This is cancer of all types. So we're saying 30% of the population will develop cancer in their lifetime. Whether early stage detections or late stage discovery, that's very significant. Very, very significant. Okay. What are the factors that influence the higher mortality rate? Risk factor, it should be cigarette or vaping. Do you know that if anybody smokes or vapes in the past, all the flavor cigarette, menthol additive, including vaping substance, has been banned in California, not US. We have a much stricter law in terms of that, and that is precisely the reason why flavor cigarette or vaping agents are no longer available here in California. High BMI index. High BMI index meaning overweight, obesity. Overweight and obesity in TCM, we interpret it as yin body type. Having a yin body type means you are having accumulations of damp and phlegm. What does that mean? It means that if you have damp and phlegm formation or accumulations in there, that means your qi or yang of a specific spleen and kidney is insufficient. Insufficiency of qi and yang, as a result, will fail to regulate the fluid metabolism in the body, allow them to accumulate, hence phlegm form. Earlier, I talked about damp and phlegm formation that will further inhibit the qi and blood flow. So damp and phlegm formations here is giving rise to the possibility of abnormal cell growth, which is what we talk about tumor. So I'm tying it in, high BMI index, why? Because in TCM, we interpret that as generally qi or yang deficiency of spleen or kidney with the abilities, not ability, sorry, with the probability of accumulate damage and eventually phlegm. Alcohol consumption. Alcohol is very young substance because they are pungent, they're warm, and the alcohol content is high. Typically, beer and wine is still within the okay. But if we talk about spirit, you're talking about 40% by volume. And some of the really strong alcohol, I've seen alcohol in 67 to 70. I personally had the experience of 67 to 70% alcohol by volume. You know what that is? That is your isopropyl alcohol. You can light it up and people consume that. What is that doing to the stomach? What is that doing to the body? So you are bringing in something that would know it will impair the DNA repair gene and disrupt the p53. Low fruit and vegetable intake. You're not giving your body enough antioxidant. You're not taking enough vegetable in here intake, which is what? Higher in fiber. High fiber can help to eliminate. We talked about detoxification system earlier. Lack of physical activity. Inactivity slowing down the qi and the yang movement of the body. So if you are slowing it down, it will be consumed, eventually allow yin influence to accumulate. Early detection is the key because this will influence directly of treatment options as well as the outcome, meaning you have much better prognosis with early detections. Ability to access proper care, both availability of care and also the financial means. Our system, medical system here in the US, unfortunately, I deal with so many of them in terms of patient, and I have not had one patient happy with what they are dealing with. I have made some recommendation, let's do this test, but because of the insurance, the way the insurance works, they were not granted that particular procedure or test because this is not necessary. Medical insurance company is all about money. They try to minimize as little payout as possible, but that is not the best care for the patient. So patient here are only a number that insurance company. Now, if you are capable of self-pay, that will be a different story. But the reverse side of that is self-pay. You know how expensive medical expenses are here in US? It's ridiculous. The outcome and the prognostications of your cancer development is really can be complicated based on, do you have the existing health condition when the cancer condition is discovered? Do you have an immunodeficiency? Do you have hypertension issue? Do you have stem cell anemia? Do you have pernicious anemia? All those conditions can definitely impact the treatment choice, the outcome, and definitely the prognostications of the cancer treatments. Any question thus far? All right. These are the number compared to men and women. Lung cancer is still top of the list. However, I think recently, breast cancer has replaced lung cancer as the top on the list. And that is 2025 numbers. So for men, looking at lung, prostate, colon rectal, pancreas, liver, and down the list to leukemia, esophagus, bladder, etc. I break it out, the number for you. For women, same thing, lung, pancreas, colon rectal, uterine cancer, ovarian cancer, leukemia, brain and nervous system. Those are the lower number on the totem pole. Figure this one out. I don't need to annotate it no more. Okay, let's look at lung cancer. So for lung cancer, basically we have two subgroups. First subgroup is called small cell SCLC, small cell lung cancer. The other subgroup is non-small cell lung cancer. The small cell cancer, we have small cell carcinoma, or sometimes it's called oak cell cancer, it's referred to. The other one is a combination of two, combined with small cell. Non-small cell carcinoma will have adenocarcinoma. This is the highest incident, this is the most common. Squamous cell carcinoma and large cell carcinoma. Those are the classifications of lung cancer. So the breakdown for lung cancer classifications. Adenocarcinoma is most common, often found in the outer part of the lung. More centralized is the squamous cell. And this is more often found in smokers. From the bronchial to bronchus. The last cell is less common, but if you are discovered with large cell carcinoma, the metastasis rate is very high and very drastic. So this would have a high incidence of mortality. Non-small cell make up for about 80 to 85% of the lung cancer diagnosis. The remaining 10-15% or so is small cell lung cancer. Small cell carcinoma, oak cell, or combined with two, grow very fast, very difficult to treat. Even though when the tumor is detected, it localized small, but it's already get into the lymphatic system and already spread to other part. So if you are diagnosed with small cell carcinoma or large cell non-small cell large cell carcinoma, those are usually have a gloomy outcome. Especially if you can get it in early stage, maybe treatment option and anything else combined, you will have a chance. But if you are in a later stage, 3 or 4 with large cell carcinoma or small cell carcinoma, generally is not optimistic on long survival rate. So these are the, aside from the obvious, for the last decade or so, blood tests have helped a lot. Although some of these tests may not be specific enough, but yet will give a provider a very clear picture of what they're dealing with. Okay, so these are some of the tests. The CEA is very common because this is to measure the protein. Can be elevated in various cancer, including lung cancer. So in lung cancer, we use the CA blood marker test is quite often. This is, I only highlight the more common one that your provider probably will order for you. If not, do pay attention to see. Make sure you ask your patient to help their provider to order certain type of this test to help you better guidance or better understanding of where they are dealing with. There are some other specific antigen tests. These are the white one here are the more important, and this one is still very helpful, like the EGFR, and measure the function of the kidney, exactly, see if there's potential metastasis to different part of the body. This information I researched it for you, but you can all easily access online, okay? So I don't need to go over them word for word. Let's talk about symptom of lung cancer, early screening. So symptom of lung cancer, as we know, persistent cough that won't go away. It's not the type of cough you're associated with cold, influenza. In TSAM, we'll talk about exterior invasion of wind, cold, or having phlegm problem. That's chronic persistent, especially when it coupled up with blood. Now, coupled up with blood in a coughing spell, bronchitis, that can happen. But a bronchitis with treatment or with a few weeks eventually go away. That blood streak or bloody sputum would disappear. This one won't. This one, you have to have cough, persistent, chronic, and constantly you will see blood coming out. And that's absolutely a telltale sign of you having lung cancer. You're having shortness of breath, wheezing. So asthma, like some people say that, oh, I have history of COPD. That's fine. COPD is not lung cancer. Hoarseness of the voice box, coupled with chest pain. Usually the chest pain you can identify in one area if you do have that cancer mass. Swelling of the face and neck, lymphatic system is start to involve. Arm and shoulder pain, and the armpit lymph nodes are swollen. Pneumonia, bronchitis that persisting and won't go away, as well as affecting the nervous system changes. These are some of the notable symptoms. Easy. Again, you might have a lung cancer when undetected because they are completely asymptomatic until stage 3 or 4. So how do we know? How do we know, and what are the precautionary? If you do have experiencing pulmonary symptom, If anything lasts more than 2 weeks, it's wise to have a baseline X-ray. But if you are a smoker, if you are inhaler, recreational inhaler individual, I'm talking about recreational drugs and substance, then you could ask for specific X-ray that target looking for changes of the lung, not just big, a little bit more specific. One of them that I usually recommend is HAP. I know some people will say, isn't that overexposure to radiations? I said, you don't do it unless you suspect. Because I have, for example, let's low-dose CT scan. What does CT scan do? CT scan can help pick up, especially the chest, can pick up small nodule, and they can identify those small nodules are calcified or non-calcified. If the nodule is calcified, you don't have to worry about it. That's quite common. But if you have a non-calcified nodule, not one, but multiple, and within a small size, I'm talking about 2, 3 mm up to 5 mm, then you know those are potential tumor growing nodules. So if you do have that for any exposure, I would recommend 3 or 5 years to come back and have a low dose CT scan specifically targeted lung cancer. I have probably 2 or 3 of them. Fortunately, with not a calcified nodule. Because I broke my rib exactly 3 years ago. I broke 7, 8, 9, and 10 rib on my right rib. I fall from second floor through the first floor. Not through, but I was fortunate enough to cut on the one of ceiling joint. I was left dangling, got pulled up, fracture, or without display, thank God. And then at that time, I had a CT scan. They saw 3 calcified nodule. So even with calcified nodule, in a couple more years, I probably will have a low-dose CT scan again, just to see if those calcified nodule would have changes or new nodule form. So that will be something that for early screening, I will strongly advise. If you suspected it, we talk about tumor marker blood test, the previous slide, and you guys can discuss that. If you think you're potentially having issue, you can discuss that with your doctor. So treatment option for lung cancer. Surgery, it can only be performed as a small and early stage detection and depending on the cancer type. I had a patient who came to me with stage 4 lung cancer, squamous cell. The cancer cell was so big that protrude through her back rib cage and with the size of a softball. We'll talk about 7 or 8 cm. So whole gobble size protrude beyond the rib cage on the back, on the right side. Chemotherapy. Chemotherapy usually referred to more general, and this could be very harmful and not only inhibit acute cancer cell, but there's no guarantee and wipe out all your healthy too. Radiation therapy. How many sessions radiation therapy could be extremely harmful because it burns and a lot of nerve damage as a result of radiation therapy. Okay, so none of this is something we said, I'd rather have this than that. It's all depending type and stage. Targeted therapy is something relatively new for the last maybe 10, 12 years. More targeted, more specific to that specific cancer cell. Immunotherapy, taking body. This is probably closest to the concept of dealing access and supports the righteous in TCM interpretation. Cryotherapy, less common, less specific. Those are non-small cell. The small cell, chemotherapy generally, radiation therapy, surgery, advanced lung cancer, chemo, targeted, etc. So all cancer, from a biomedicine perspective, you're probably looking at it right now. I'm sure there are some additional option choices, but this is what we call mainstream. Mainstream recognize this is the only way to handle cancer. So this is what you guys are here for, right? See if I can help integrate the Eastern and Western philosophy of cancer management. So the cancer treatment in TCM remains the most ancient living traditions. The word 肿瘤, tumor, that equate to cancer. That terms is already been 3,500 years in oracle bone inscriptions. The word 肿瘤 has already been mentioned and brought up. What is our history of our bio or modern medicines? Not until 1400s. Okay, our history, the Western or biomedicine's history is really only a few hundred years. Okay, I would say probably 700 years, 800 years. The holism of interconnected and mutual restraint inside the human body, the concept of treatment according to syndrome differentiation that have been reflected in cognitive cancer etiology and principle of diagnosis in treatment of TCM. So what on earth is that rambling? Okay. Maybe I want to see. Okay. So what it's saying is, in TCM, the difference between biomedicines and TCM, aside from my immunotherapy, the treatment of cancer is very aggressive because biomedicine really target the abnormal growth of cell. And that become a focal point of treatment. Eastern medicine really should be supported in before, possible during, and the after effect. And let me explain to you why. In TCM, the before part is when you understand the balance of yin yang. Yin and yang need to be balanced. This is the blueprint enable your DNA repair gene to sustain its ability. And then promote your P53 factors. What does P53 factors mean in TCM? Invigorate the qi and blood flow, prevent it from static, transform damp phlegm, clear heat, disperse cold. So basically, that what it means is you want to regulate the yin yang, prevent exogenic factor from injuring the body, throwing your body into an imbalanced mode. Consider your endogenic factor. This is extremely important in TCM. A lot of people looking for pathological influence, but somehow have forgot about the emotional constraint in TCM, just as important compared to a simple heat, cold, damp, phlegm, fire, and dryness. Because 七情六欲, right? 外邪内因, 外邪 I mean exterior pathogen, 内因 internal causes, enogenesis, emotions, anger, worry, joy, fear, all those could derange, scatter, stagnant, knotted, sink the qi, affect the yang. So when you sink the qi, affect the yang, derange the flow of that, it affects the normal circulatory system of blood. When the blood is not moving, it becomes stasis or static. When it becomes stasis or static, qi is not moving. That could have vessel changes. That could have abnormal vessel infiltration. That could have mass form because qi and blood is not moving. That give rise to fluid. Fluid will accumulate, turn in phlegm. So when I said pre-cancer treatment is at the early stage, if you are sensitive to your body, know what to change, any early detection will be very helpful. We can step in and concentrate on that. Does that mean we won't be able to address cancer treatment? Oh, yes, we can. TCM have scientifically, a lot of studies show that actually herbs and formula have very positive, this is scientific based finding, very positive on cancer treatments. And the post biomedical treatment, regardless of either as radiation, surgery, excision, resections, talk about chemotherapy, targeted therapy, etc. During, we can support. After, definitely we can restore. So that is what I want to integrate that and give you an understanding. As specifically, we're going to specific cancer, we will talk about some of the herbs, some of the point, how you can use it and use it effectively. Diet induced. Diet induced. Two things I want to mention to you, and I want to refresh your memory about the TCM theory. Two organs that specifically open to the exterior, aside from the lower part of the body. Those are your lung and stomach. Lung open to the respiratory tract, stomach open to the mouth. We talk about lung also fans up the skin. So we talk about carcinogen. These are the two most common routes or cancer, whether it's from environment, whether it's from food and drink intake. So do remember that. Okay, when we talk about food intake, drink with contaminants, air you breathe with contaminant are carcinogens, contact development in case of skin cancer. Those things I want you to put in your back burner, constantly thinking. Next point is the strength of pathological influence. The strength of pathological influence here, you have to bring back about the equilibrium point, the patterns. If you resistant, if you're Myra, should we take a break or should I go on?
Yeah,
I
we
don't
can
know.
take a break when you're ready.
I think we should take a break for our attendee. Otherwise I won't stop.
Okay, yeah, we can take a
Okay,
15.
let's take 15-minute break because I don't want to get interrupted the next few points. Okay.
Okay, sounds good, Dr. Law. Thank you.
Okay.